Hi, today I'm going to discuss gene therapy for hemophilia B. There are two main forms of hemophilia, being hemophilia A and hemophilia B. Based on research from the Centers for Disease Control and Prevention, 1 in 5,000 men are born with hemophilia A, and 1 in 30,000 men are born with hemophilia B. Hemophilia B, also known as factor IX deficiency, is a type of hemophilia that causes individuals afflicted with the disease to bleed excessively from injuries because they lack clotting factors in their blood. A mutation on the factor IX genes causes a deficiency in the factor IX protein. Hemophilia B is a genetic disease that is linked to the X chromosome, and it is inherited in an X-linked recessive manner. Men have XY chromosome, women have XX. An example of this would be a mother who has an XX chromosome, with one of her X chromosomes carrying the gene for hemophilia, which she can pass down to her son, who has only one X chromosome, and he will have hemophilia. Hemophilia B affects men more often than women because it is an X-linked recessive trait. Individuals that have hemophilia B are typically more susceptible to bleeding, especially internally. Bleeding can happen in the joints and in the muscles internally, and can occur from cuts or bruises externally. There are 3 levels of severity that hemophilia B patients can suffer from: mild, moderate, and severe. In healthy individuals, their plasma levels of factor IX are between 50 and 150%. Patients with mild hemophilia have factor IX levels between 6 and 49%, and those with moderate hemophilia have between 1 and 5%. Those with severe hemophilia have less than 1% factor IX. Based on data from hemophilia patients at circulating levels of 12%, factor IX abnormally provides enough factor IX to prevent bleeding episodes and the need for injections. Coagulation occurs in response to damage to endothelial tissue. When collagen, a major component of endothelial tissue, is exposed to circulating platelets in the blood, a coagulation cascade is initiated. In order for fibrin, a major protein involved in clot formation, to form, a series of enzymatic steps are required. One of these enzymatic steps requires clotting factor IX. In patients with hemophilia B, the deficiency in this clotting factor impedes the coagulation cascade, making it nearly impossible for the body to form enough clotting protein to stop the bleeding from the wound. Treatment for hemophilia B involves administration of a concentrated dose of factor IX product, either into a port in the chest or a vein in the arm. When factor IX is administered, it allows the coagulation cascade to continue, resulting in the formation of a stable clot. Factor IX administration can cause chills, flushing, headache, nausea, and/or vomiting. In rare circumstances, patients will have shortness of breath and changes in the amount of urine, which can be a sign of kidney problems. One potential risk factor is viral infections. Since factor IX is derived from human blood, there is a chance that viral infections such as hepatitis can be contracted from the use of this drug. While administration of factor IX is effective in treating the disease, it is not a cure. Patients must receive injections every 2 to 3 days, which makes it very inconvenient and invasive. It is also very expensive. Patients must spend upwards of $250,000 a year on the injections, which is unaffordable for most patients. Those patients who cannot afford regular doses and are severe hemophiliacs suffer greatly. They typically have reduction in life expectancy. Somatic gene therapy for hemophilia B provides the potential for a curative effect based on clinical trials. In a paper published in 2014 by the New England Journal of Medicine, patients with hemophilia B were treated with a dose of self-complementary adeno-associated virus serotype 8 vector, also known as AAV8. Gene therapy is the delivery of a gene into a cell via modified virus or other delivery tool, and incorporation of the gene into either somatic or germline genome. Once the gene is incorporated into the genome of the cell, it can produce messenger RNA that can then be translated into protein. In this study, an AAV8 vector was used containing a hyperactive version of the factor IX gene, called the PDU variant. Factor IX is produced in the liver, so the virus targets liver cells. This variant of the gene has 8 times the activity of the normal gene, meaning that it produces much more factor IX than usual. In this 10-person study of hemophilia B, all patients showed an increase in their circulating factor IX levels between 1 and 6% of their normal value over a median period of 3.2 years. And it was observed that after the therapy, there was a 90% reduction in the occurrence of bleeding episodes. While there were adverse effects from the study, no toxic effects were reported. Over the course of the study, there were 128 adverse effects reported. However, 98% of those adverse effects were mild in severity, categorized as grade 1, meaning that they experienced mild discomfort and no medical intervention was required, such as acne, lethargy, cough, nausea, fever. And out of the 128 adverse effects, 86 of them were determined to be unrelated to the study. In a press release from Spark Therapeutics in May of 2016, consistent levels of factor IX were reported in 3 patients that were part of the study. It was observed that at 8 weeks, the first patient's circulating factor IX level stabilized at 28% of the normal level. The second patient stabilized at 30% after 7 weeks, and the third patient stabilized at 16% at 3 weeks. The patients are effectively cured of hemophilia B. However, not all patients can be treated with this therapy because 40% of hemophiliacs have antibodies to the viruses, meaning their bodies would destroy the virus before it can infect their liver cells. To get around this problem, Spark Therapeutics will try releasing decoy viruses to bind to circulating antibodies. Another possible negative outcome from using an AAV8 vector is that the virus inserts the gene randomly into the genome, leaving the possibility of insertional mutagenesis, which could lead to cancer. To avoid both immune response and the potential for cancer, CRISPR-Cas9 genome editing has been used as a delivery vector for the factor IX gene. CRISPR-Cas9 genome editing is a prokaryotic immune system element capable of cutting viral DNA at specific sites. This technology has been repurposed for the use in biotechnology, allowing precise genome editing in almost any living cell. The precision and ease of this technique allows for a very effective treatment option. In this study, a mouse strain was generated carrying the hemophilia B mutation. They then corrected the mutation in the adult mouse using a plasmid containing the CRISPR repeat, Cas9 protein, and the transgenic factor IX element. Up to 1.5% of the hepatocyte cells, or liver cells, showed uptake of the corrected genotype without producing any hepatocyte damage from an immune inflammation response. Advances in gene therapy have a potential cure, but not all hemophiliacs can benefit from those therapies. Given the fact that they use a virus to deliver the gene, and the body's immune system may destroy it before the effects of the treatment can take hold. But as science and technology continues to advance rapidly, new treatments are on the horizon. In the near future, we may be able to take advantage of CRISPR-Cas9 effectiveness in gene-specific genome editing to provide a safe and effective cure for all hemophilia B patients.